pleasure to introduce the chief guest of tonight, Dr. MADHUYRY, lead contact tracing clinical epidemiology at New York City Department of Health and Mental Hygiene. She works at the intersection of medicine, data, health equity, and public health. It's all in one in the New York City Department of Health and Mental Hygiene. She's been fighting against COVID-19 outside of COVID-19 response work. She is the Director of Data and Analytics for Child Care. Dr. Ray completed her medical degree at the Drexel University College of Medicine and trained in general surgery at the Massachusetts General Hospital and the University of California in Los Angeles. She additionally completed a master's in public health from Harvard T. Chan School with a specialization in global health and concentration in humanitarian studies, ethics, and human rights. So now I would like to welcome Dr. MADHUYRY.
Thank you so much, everyone, for having me here. I'm so proud to be a part of this community that we all share, and to be here to talk to you about COVID-19. I think this is a day of reflection, and so I'm going to do just a moment of reflection. As a scientist, as a public health professional, I don't have to tell anybody here the impact of COVID-19 in this neighborhood. At the beginning of COVID, we didn't even have any tests, right? This neighborhood, there were lines, there were trucks outside of Elmhurst Hospital, right down the street. We hear every day, everybody here knows somebody, has a family member, has a friend who has passed away from this disease or who's suffering the long-term consequences. And we have come very far, right? We've come very far since those days where we will never know how many people had COVID at that time because we didn't even have tests then. Now, the science has advanced, right? We have abundant tests. You can get a test in your home. We have become accustomed to wearing masks, to physical distancing, and most importantly, science has made these advances with the funding, with the cooperation of everyone, corporations, of scientists worldwide. We have not just one, but 3 highly effective vaccines for COVID. But as far as we have come, as much as we have learned, we still have far to go. And as I reflect, I'm not just going to reflect on science and public health, but I'm going to reflect on faith. Right, so before the pandemic, America was becoming more and more secular, right? Secularization was creeping into every piece of American life. And that's actually reversed in the pandemic. Not every country had this reversal where people turned to faith or felt that their faith was stronger after the pandemic. That's pretty unique to the United States. And, it's, of course, natural in the face of tragedy, in the face of change, in the face of massive uncertainty to turn to faith. But this is something bigger than individual fears, than individual concerns. This is something really existential that we're seeing, right? You talk about anti-Asian hate. We have these big questions. One of our speakers spoke about the violence inherent in this disease, right? So this is a fear. Where does this virus come from? Did it come from another country? Is there another race? Is there another people? Is there somebody, are they all coming out to get me? Because I can't understand, I can't fit in my head the nature of the reality around me, right? We see this with the mistrust of vaccines. Is Bill Gates causing this? Is it a corporation? Is the government giving us false information? Are public health leaders lying to us? And what we can see is that science is not enough to answer these big existential questions. We're seeing that around us. The words of science are not eternal, right? That's the nature of science. Science is not immutable, medicine is not immutable, guidance is not immutable. These are things that are supposed to change. These are not supposed to be words of faith, right? The words of faith come to you, right? This is the responsibility of the faith leaders in this room. It's the responsibility of the faithful in this room. Science and faith have to work together. This is something we've heard today about how important this is, how important any intervention is, right? Every single thing that we do, nothing works on the individual level, right? On the individual level, we're stuck. We may be safe as individuals, but we're stuck in this pandemic. This is something that happens on the community level. This is something that happens with all of you getting the correct information and sharing it. I think that we probably don't have time for a question and answer today. I will stay back for a little bit, if you have particular questions. But I encourage you to look at our website. The guidance is updated there frequently. The website is www.nyc.gov/health/coronavirus. We have a speakers bureau where I will come and talk to you, or another one of my excellent colleagues will come and talk to your groups. I think I've talked to I've talked to some organizations here already about the pandemic, and I'll sit with you and answer those questions. I'll share the work and the burden of answering these big questions with all of you. If I have to say three things, I will say that there's a lot in the news about the vaccines, but the vaccines work. All of the vaccines work. The 3 vaccines that are available, Moderna, Pfizer, and Johnson & Johnson, all of them work despite variants, despite the news, despite all of these changes and this turbulence that we've been facing for the last year and a half, almost 2 years now. There is a lot of, I'm happy to give you information, but very quickly, the website vaxfinder.nyc.gov is ways to find vaccines. You can pick which kind of vaccine you want. You can look at hours. Places are open. You can look at distance. If, we're having pop-up sites, especially this weekend, we had a series of pop-up sites with organizations all over the city partnering with communities of faith, partnering with faith leaders. And, please contact us, and we're happy to help you with that. I'll also say that, we heard a lot about mental health. This reflection is painful for all of us. Some of you were in tears during this, as we reflected on the last year and a half. Some of you didn't have tears on the outside, right? They weren't visible tears, but this is a level of trauma that will be difficult for all of us to recover from. You as faith leaders are mental health care providers, whether you like it or not. And I think that, faith can be a barrier to seeking out help. Faith can be the motivator to seeking out mental health help. We have many resources that we can share at the health department. One of them is called NYC Well. It's a hotline that occurs, that's open 24 hours. It's also very easily accessible from our website. And with that, I just want to, I'm not sure if we have a moment for questions. I don't think we have a moment for questions, but you can find me afterward. Or of course, I'm happy to come and speak to you. But I just want to thank all of you, to acknowledge the work that you've been doing, while we were on the front lines, while we were, in the hospitals, while we were making the guidance and figuring out, what the virus was doing. You were not in the same room, but you were with us the entire time. And if we have come far, it is because all of you have helped us get here. Thank you very much.